Welcome to MenopauseWize. I am Dr. Sukhpreet Patel, and today with us we have Dr. Deepti Ghia. Dr. Ghia is a consultant dermatologist and trichologist at the Jaslok Hospital, Mumbai. She is also the medical head at the South Mumbai Dermatology Clinic. She is an active member of the International Pigment Cell Research Group and of the Cosmetic Dermatology Society of India. She has over 14 years of experience in dealing with women's skin issues, and today we will be specifically discussing skin changes during menopause. So welcome, Dr. Ghia, and thank you for joining us today.
Thank you. Thank you so much for this opportunity.
So let's get started with the hottest topic, aging. Women typically undergo menopause between the ages of 45 and 55. Would you say that there is a specific change in the way we age as regards to our skin during menopause? Or are there any other changes that occur to our skin during this whole menopausal transition?
So once we cross our 30s, the skin starts undergoing age-related changes. But when we reach our perimenopause age, the estrogen amount kind of keeps dropping down. It goes lower and lower. And then with that, there is an unchecked action of the male hormone in the body, that is the which does not reduce. So there's a balance which is lost. So in perimenopause itself, we start seeing certain changes. But once the estrogen levels completely go, then it is where sudden drastic changes are also seen in terms of collagen levels. There is a drop of almost 20% of collagen in the first few years of menopause itself. And then that leads to the skin becoming saggy, it's becoming dry, and then pigmentary changes also happen because of the menopause. So if you go to see skin and menopause, you can see different changes in terms of if you say it as pigmentary changes, then that comes as melasma or other kinds of hyperpigmentary changes on the skin, or sunspots and age spots come in. Then in terms of loosening of skin and dryness of skin, so development of jowls and skin becoming thin, that becomes one part. Third thing is extremely dry skin. So you need to increase the amount of moisturizing that you need, because the skin's water holding capacity goes down. And then there are hair changes also that you see. The hair on the scalp goes down, and then you start developing hair on the chin, and hirsutism kind of can come in. So there are different changes that happen, all because of the sex hormones that are going down. Your estrogen, progesterone are not going to cyclically come as they used to come before, and that is a big change for the body.
Right. Could you tell us, because a lot of listeners may not be familiar with the term melasma. What is melasma?
So melasma is a kind of hyperpigmented condition. It's a pigmentary condition, means it presents as dark colored spots on the face. They are flat. So when you touch the patches, they are not raised, neither are they itchy, or they don't have any other symptoms. So you don't feel anything on the skin. But when you look at yourself in the mirror, you see that there are patches that develop, usually the cheeks, the foreheads, then, the upper lip. These are the locations where you can see pigmentary changes. And this melasma is usually, responds well to tranexamic acid and other, skin lightening agents like hydroquinone. And that can help.
So this particularly happens under the influence of hormones, right? The
Yes.
melasma, right?
Yes. So there are two peaks when melasma happens. Usually, the first peak happens when during pregnancy, and the second peak can happen during the menopause. So these are the two times you get this, because those are the times where extreme hormonal changes can be seen.
Right, right. Also, I've observed in my earlier years, the women on oral contraceptive pills would also have a higher risk of developing melasma, right?